welcome to the evolving field of hyperbaric medicine, which has recently achieved landmark status of nationwide certification. He is the former medical director at the Hyperbaric Medicine Unit at Toronto General Hospital of the University Health Network. In recent years, he has been with Medical Oxygen Repair, a clinic where he expanded on the design he developed of the Toronto General Hyperbaric Medicine Unit, only larger. Medical Oxygen Repair is the largest hyperbaric facility in Ontario.
With us today is Dr. Wayne Evans, a leader in the field of hyperbaric medicine for 2 decades, across Canada and internationally. So Dr. Evans, can you tell me about how the Royal College is involved in the field of hyperbaric medicine?
Certainly, it's an important point. As many would know, the Royal College of Physicians and Surgeons of Canada specifically certifies all of the specialists, be it medical or any of the surgical specialists across the country. It sets the bar that you've got to get to, and it defines the competency standards that have to be achieved and evidenced to be a specialist. So it's all about standardized care and quality assurance. Gone are the days of self-proclaimed expertise and baseless claims with promises of unrealistic treatment outcomes.
Thanks, Dr. Evans. So, can you tell me, what is hyperbaric oxygen therapy?
It's a phenomenal tool. It allows you to be super saturated with oxygen. And what's profound about that? Well, for decades we've been using white blood cells' need to kill bacteria by powering it with hyperbaric oxygen. So hyperbaric oxygen plus antibiotics, great combination for serious infections. On the other hand, recent research has shown us that you can actually stimulate repair cells to pour into the bloodstream at phenomenal levels, maybe 10 times resting levels after a few weeks of daily hyperbaric treatments.
So, what happens to these repair cells? Why do we want them?
Well, one of the reasons people come to see us at the hyperbaric unit is they've got wounds that won't heal. These devitalized tissues may have just lost that ability. And we can use this boost in repair cells to heal fast and strong as a result.
Can you tell us, what does certification mean to us Canadians? Is this the same thing that Americans refer to as board certified?
Exactly. It's exactly the same as board certified. You're getting services you're getting are at the highest level of professional knowledge and quality, board certified.
What's been your role in the journey to hyperbaric medicine certification?
Wow. Well, after more than a decade as the physician responsible for the biggest unit in Canada, hyperbaric unit at Toronto General Hospital, we had amassed a significant caseload of experience, and I had trained many physicians in this type of work. And in fact, we managed to get some really fancy technology. We managed to upgrade our equipment that had been there for about 40 years. And so I went to Australia with the support of the hospital to search and explore the newest technology, which are rectangular steel hyperbaric chambers. In fact, we brought the first one of its kind to North America in 2006, which was an awesome and delightful experience. To celebrate that, I hosted a series of annual international symposiums, which were an opportunity for physicians across the country and internationally skilled in this area to come together and learn from each other.
So this is basically how you guys got certification? You guys created an entity in 2008?
Well, it's not that simple. That group alone wouldn't actually have the power to legislate which has happened since that time. It's the Royal College that has the power. In fact, this group turned into eventually a national organization called the Canadian Undersea and Hyperbaric Medicine Association. And I was the founding director of that. So that organization called CUMA applied after several years of amassing hundreds of pages of documents to the Royal College in 2012 for certification or to be invited into the Royal College to be part of the national program of specialties, which is what we did. In fact, and the Royal College then adopted this and created a working group out of some of us that were involved with this, and we created the modules and training competency requirements for the Royal College under their direction. The work was completed in 2017, and in February of that year, the Royal College declared the Advanced Focused Competency Certification in Hyperbaric Medicine to be proclaimed. So it's been my privilege and honor to be involved with and serve on all of these committees over that whole decade.
When can we expect that doctors will receive this certification?
Well, of the handful of candidates thus far, 3 have achieved the certification in 2021. And there will be likely several more in 2022.
And how would you say that this certification is going to improve the lives of patients who are receiving hyperbaric oxygen therapy?
This establishes hyperbaric medicine as a legitimate field across the country. It's endorsed by and under the governance of the Royal College, and that pretty much ensures the highest standards of care.